From the Evening Standard in London, I'm David Marsland, and this is The Leader. If you were thinking that maybe this coronavirus pandemic might be coming to an end, the World Health Organization's boss in Europe has a message for you.
A 10-week decline in number of COVID-19 cases in the 53 countries in the WHO European region has come to an end. Last week, the number of cases rose by 10%, driven by increased mixing, travel, gatherings, and easing of social restrictions.
Dr. Hans Kluger is warning of a new Delta variant-fueled wave of COVID-19 hitting Europe this year. Vaccinations, he says, are vital. In London, an enormous effort's underway to get jabs into people's arms. But at the moment, official NHS England figures suggest that at the current rates of 42,000 injections a day, the city could fall short of the Prime Minister's national target by about 1.5 million jabs. Our health editor Ross Lydall caught up with the Mayor of London, Sadiq Khan, to find out what's happening with the rollout and why he believes the capital is in prime position to reopen safely on July 19th.
The figures that Martin McRae gave of 9 million jabs given in London is quite a bit higher than the official tally. What's your sense of where we're at?
Well, there's always a lag in relation to the official figures for good reasons, and the figures we know, which are real-time figures, and that's understandable. The key thing is not to compare a global city like London with respect to some towns and cities across our country. We're a city that should be compared to New York in relation to the challenges we face. Young population, more diverse, more mobile, less likely to be registered with a GP, but also a big migrant population, unlikely to be registered with a GP, but also less keen to share information. That means the official channels of communication we rely upon to invite people for a jab, to text people, the National Booking Service doesn't apply. If you're not registered with a GP, you can't use any of those things. So notwithstanding that, it's been remarkable in the last 200 days, the progress we've made. There's a jab given every 2 seconds. That's the sort of numbers we're talking about. Last weekend, we think we topped 120,000, the weekend before 135,000. And so we're going to carry making progress over the next few weeks. And I think what you heard yesterday was people who have been experts at vaccine rollouts in previous years around the world actually recognising the fantastic progress we've made. We should celebrate the progress rather than always doom and gloom.
What's your view on the eligibility criteria? Because Mayor Phil in Hackney was suggesting that the mass vaccination centres were particularly useful, and perhaps it should be a bit of a sort of free-for-all in terms of walk-in for anybody over 18, just turn up and get it. Would you endorse that view?
That's what we've got. So the mass walking centre, the walking centres we've got across London, the mass vaccination centres, but also some of the other ones, you can basically rock up. You don't need to be registered with a GP, you don't need to know your NHS number, you just turn up. If you're above the age of 18 and you've got an arm, you can get a jab. That sort of grab a jab approach is really important because particularly men below the age of 40, a large proportion aren't registered with a GP, and you can understand why. Hardly ever unwell. If they're unwell, they probably go to the pharmacist, get some medicines from the pharmacist, and so they'll see the need to be registered. The other big problem we've got in London is many people are registered with the GP and then they move even out of London, and so it may look like we're not getting the high numbers for those getting the jab who are registered. That's because they may have moved out of London and they've kept the GP here and then they've not needed to change the GP. So that's why the numbers the numbers that the government's providing aren't as accurate as the ones that you heard yesterday. And the other big thing is we're now starting to use ONS data in relation to working out the percentage of Londoners who've had the jab rather than the NIMS data. The NIMS is the GP's registration, because there's a big gap between those who are Londoners but aren't in GP roles.
And you're also particularly keen to get as many Londoners as possible to have 2 jabs by July the 19th. Would you like to see the sort of, again, a relaxation of the 8-week rule between jabs? Do you think, some places are apparently giving it after 3 weeks on Sunday? Is that an approach you would welcome?
Well, if you remember, the Chief Medical Officer, Chris Whitty, back in January, I think, changed the time from the first jab to the second jab from 3 weeks to 12 weeks for a very good reason. Because the advice was we'd rather have more people receive at least some of the vaccine than a few people receiving both doses, and so they are protected, but the vast majority aren't. So Chris Whitty's advice was to change it from 3 weeks to 12 weeks to get more coverage. And actually that's worked, because you saw a big reduction in numbers of people with the virus being in hospital, the numbers of people with the virus on ventilators, and the number of people with the virus dying. So the Chief Medical Officer's advice worked in relation to 12 weeks. They've now, because we've now got more availability of supply, reduced that from 12 weeks to 8 weeks. And that's the advice from JCVI and the regulators which we support. I think what you'll find is, as we approach July the 19th, if there is more supply, it's a big if, that advice may be changed, but at the moment the advice is 8-week gap between the first dose and the second dose, and there's very good reason for that, because we want to make sure as many Londoners as possible receive at least one dose. We'd kick ourselves if you had some Londoners with both doses but not enough supply for other Londoners to have at least one dose. And so the key message for Londoners over the next 3 weeks is please make sure you get at least one jab. If you're eligible to have both jabs, get both jabs. Why? Because you're fully protected with both jabs. There's a 90% reduction in hospitalisation if you receive both jabs, and so we're trying to make sure we accelerate the rollout of the vaccines across London. Good news, Nadeem Sahabi has confirmed we'll have sufficient supply of Pfizer for the next couple of weeks, which is great. If Moderna becomes available, we'll get that. But also we've been very agile across London in relation to moving supplies of Pfizer, not just within different parts of London, but also even within boroughs, because of the progress we've made.
Okay, and just last question, but overall it sounds like you're pretty confident that come July the 19th we'll be in as good shape as possible to be ready for a relaxation if that does happen. We'll have given it a really good go. Even if we don't get 100%, we'll be as good as there.
Listen, we're throwing the kitchen sink, kitchen appliances and myself at this. We're going to make sure we get as much coverage as we can. The target is we want 2/3 of Londoners to receive both jabs, and every Londoner to have been properly off at least one jab. I'm confident that London will have played its part in making sure we can fully reopen on July the 19th. I think it's important for us to fully open on July the 19th. We're ready.
And that's the leader. You'll find more on the story at standard.co.uk. Please do come back tomorrow at 4 p.m. for more news, analysis, interviews and features.